Hello and welcome to a really exciting session here at the virtual series for the Self-Direction Conference. This is a session from Metasced on how natural language processing can be used to improve outcomes in self-direction. My name is Doug Olive and I'm president at Metasced.
Hi, everyone. My name is Alyssa Galaney, and I am a client success manager here at Metasced.
And we'll be looking at artificial intelligence today, and that's what we assume it looks like. So for today, we've got three major topics that we'll be covering that hopefully opens up some of what we hope is a very different kind of presentation and very forward-looking, future-looking presentation. We'll start with some of the feeling versus knowing. And we've all have feelings about equity in self-directed systems, pockets of equity. Feeling versus knowing means we take some data today and actually put some data with it to be able to understand what's actually going on in our service delivery systems. We'll then be looking at machine learning and understanding how natural language processing, which we've all been hearing so much about in all other aspects of technology in our lives, can actually apply to self-directed services and to human services in general. And then we'll be bringing it all together with the lessons learned and what's next. It's really important that we have this disclaimer. All the data that you see today has been de-identified. We've changed the names and altered the stories to protect the privacy of individuals, but each of the stories are based on real people. We've used machine learning and artificial intelligence, and it's in its very early stages for human services. The results are not intended for clinical decision support. They're not intended for human resource management nor for any other purpose other to illustrate and raise the bar for what could be possible within the next decade and trying to bring that closer to today for what's possible with artificial intelligence and the services and supports that are available in our world. And so to start with feeling versus knowing, we want to follow some of the available data trends based on the studies that we've been able to do here at Metasced and pulling in some other national and state studies to help really make some advancements and make some progress in the work that everyone does with self-direction. And so we start with a CMS framework for health equity that spans over the next 9 years from 2022 to 2032. Within CMS's priorities for health equity, which you can read from that link, there are 5 major priorities. The first is to standardize the data. The second is to find those inequities in policies to help close those gaps. The third is to build capacity. The fourth is to make sure that services are culturally tailored. And the fifth is to make sure that tailors are actually accessible to all individuals. And obviously, as we all know, equity requires intentionality. And so you have to do something in order for equity to happen. And some of that is basically steps 1 and 2 that we take a look at today of standardizing and actually taking a look at some of those inequity data issues.
To quickly review, states determine how individuals self-direct their budgets and supports. Employer authority permits recipients to directly recruit and manage their service providers. Employer authority is integral to the self-direction model. Depending on the authority, states have some flexibility to determine which employer responsibilities can be self-directed. Similar with budget authority, this allows enrollees to manage their budgets and purchase other goods and services. States also have some flexibility in determining what types of goods and services can be purchased under budget authority, but both are really important to how individuals self-direct.
Thanks so much, Alyssa. And that kind of gets us into a conversation about equity of supports. I think probably everybody participating today can agree that self-direction can be confusing to navigate. There's a feeling that there may be barriers for some people, including the necessary skills and circles of support to manage and maintain employer authority and budget authority. These are not easy to do, especially with the current labor force as it is. This study takes a look at data around individuals that self-direct to determine where there may be room for improvement to improve equity in alignment with CMS's framework for health equity over the next 10 years. In today's study, we took a look at about 2,400 people across the United States, all using Metasced self-direction tools. They are from Alaska to Maine to Illinois to New York to everywhere in between. We studied services from 2019 to 2022. We looked at 229,839 service notes in this study. We won't make you look through all of them, but there are some key ones that are helpful. And we calculated some scores using natural language processing where we find that on a scale of -1 to 1, and we'll get into some of the science behind it, the baseline score is 65% positive. So for most people in self-direction, that's a generally positive tone, but it's those opportunities and those times where there are inflection points and rooms for interventions that we spend the most time studying today. In studying our population of about 2,400 people across the US, there are some things that we find when it comes to equity and zip code. As we know, health equity, a lot of times, the zip code that you live in can determine many factors of many aspects of the social determinants of health. And so we study those individuals that are self-directing. 100% of the people in this study have a disability, which is why they're in a Metascan database for self-directed services. And of those, where we studied the national averages, what we found is the zip codes where these folks live, which are all across the country, happen to be about 22% less racially diverse, so more skewing towards white, non-white, more skewing towards white. 22% less racially diverse than the national average. So if the national average is a baseline of 50, right, that's the national average, then these zip codes tend to be less racially diverse than the national average, which is important to point out when we take a look at ways that equity can be improved by adopting policies, programs, and practices specific to this. And we use some data from the census and the CDC to help identify this, coupled with the study. We also studied some of the income levels, knowing some of the challenges around employer authority and budget authority, and knowing the resources that are necessary to be successful for many people. We also noticed that many of the zip codes, 73% of the zip codes in our study, where clients are using self-direction, fall above the national income average. So generally, not everyone, but on the whole, there is definitely a trend that we see in the data that the zip codes and the places that we're looking at for equity tend to be those places that do have higher median incomes and slightly less diversity where people live. The individuals themselves that self-direct, that's a bit of a different story because of some of the Medicaid services that are around, but the community around that we're all a part of, it certainly is something to call out that there's a noticeable difference in the areas that we look at on average, not for everyone, but on average. We also know that staff stability has always been a challenge and is increasingly more challenges. Individuals, all of us, have some sort of trauma in our lives that trauma-informed care is the best way to identify and to support people to live their best lives. Meaning that when you have staff that have an appreciation and an understanding, and staff that you work really well with and can rely on and count on, that's a fantastic aspect when it comes to self-direction. Then there's the flip side of that. What happens when you don't have stable staff? How hard is it to find staff, especially in this economic environment with staff turnover being as high as it is? And so what we studied for the 2,396 people over this period of time from 2019 to 2022, the end of it, we did find that about a quarter of people had one staff member the entire time. And on the next slide, we'll see how many of those folks were friends or family. The average was 3 staff members per year. Over the course of the study. However, about a quarter of people had 6 or more staff members, 7% had 10 or more staff members on average every single year. And some are multiple shifts throughout the week, but some are really challenges with finding good and compatible staff. And we'll get into some of the data around the sentiment analysis and the artificial intelligence that we look at, and we can see some of this manifest itself in ways we haven't really noticed before. So that's sort of helpful. One of the other key parts is circles of support. They often include friends and family, and there's no state by state. It differs as to what's permissible, what's encouraged. However, many opportunities to use friends and family members do come up for people that self-direct. There's no perfect way to know if someone is a family member, especially if they have different names and different addresses. However, if someone does have a similar last name and the same address, we wanted just to see, this is not scientific, but this was just to sort of put a floor on the data, how many of the people, of the 2,300, 996 people that we studied, how many actually have staff that share an address with the individual or share a last name? And again, not perfect, right? You've got some very common last names out there, but we were curious. When we did that, we found that 240 of the individuals out of our 2,396, or almost 10%, 1 out of 10, actually more than that, um, actually share an address and or a last name with their staff, which means that a significant number of people, the number is probably much higher than that, but it's a significant source of support for people that for many people that self-direct, and that's important to understand those circles of supports, the stability. It's important to understand the people around you when looking at equity in service delivery. And so we start by taking a look at some of that equity. Next up, with that understood, we have an opportunity to understand more about what machine learning can tell us based on reading 230 something thousand service notes. We have the opportunity to look at trends, to look at interventions, to look at key inflection points in a person's life. And the goal is to be able to, in the future, provide alerts sooner rather than later to help people live the most independent, happiest lives that they choose, but also to have to be educated and have awareness of what's going on in their service delivery system at different levels that they never had before.
All right, thanks, Doug, for kicking us off on machine learning. So, just as everyone on this call is probably aware, a major principle of self-determination is that everyone has the right to make meaningful decisions about their life and their future. So, along with this principle, we've identified for self-direction, increased independence and choice, flexibility, empowerment, and improved quality of life. And along with that, artificial intelligence is no longer just a plot device in the movies or robots. It's here, it's the future, and we're really excited to be a part of that trend setting. So for this study, we used NLP, or natural language processing. NLP is the future of how the home and community-based service industry can extract and quantify written words and study subjective information. So Metasced partnered with our providers to conduct this study, and we examined data from a sample of, as Doug already said, 2,400 individuals from across the country who self-directed, and the service notes were reviewed with natural language processing so that we could determine satisfaction. DHHS has identified machine learning as a goal for person-centered outcomes by 2029. So as we said just in my last slide, it's not a plot device in the movies. It's not the future. It's actually here. And DHHS has it as a goal. So we're trying to leverage that and be that leading technology solution to improve that data capacity for person-centered outcomes and compare clinical effectiveness in this research, and use an AI solution to enhance accessibility and interoperability of unstructured data to enhance person-centered outcomes. So for this study, we used sentiment analysis. We use sentiment analysis as our approach for natural language processing, which identifies emotional tone behind text. We used our tools to study service notes to look for trends in tone that may relate to signs of positivity, negativity, or more neutral tones. So natural language processing is still in its early stages. So we'd like to take this time just to reinforce that this study's results don't tell a whole story, but its purpose is to help advance this technology within the the home and community-based service space. I'm going to walk you through examples of a positive, negative, and neutral service note next. So for a positive service note, we have an example that says RL independently exercised by using the bike pedestals for 20 minutes. He was verbally prompted to use the computer to look up his area of interest, and he researched trains. He was verbally prompted to speak clearly while talking and work better on posture. Staff praised RL on a great job. He smiled and said, "I try for you," and laughed. So this is an example of a positive note with the sentiment analysis.
This is also an individual who self-directs. He has a diagnosis of an intellectual disability and is hopefully living his best life through the use of self-directed services. Really positive.
Then we have an example example of a more negative note. And this is TR arrived at his church group on time. He was prompted to be socially appropriate with peers, but he refused. TR became frustrated and verbally shouted at his support staff. TR was asked to stop and to talk about what was making him upset, but again, he refused. He started shouting at his peer in the church group, and he eventually did calm down and talked about what upset him. And then finally, we have neutral. A neutral example would be RP went on a short walk, RP worked on online training, and then I met with RP for employment services at lunch. Throughout lunch, RP conversed with me about the upcoming football season. I praised RP for his hospitality and polite conversations, and RP responded by looking down. And just so everyone is also aware, these are, the names have all changed to make sure we keep people's identities private. But these are just examples of the types of notes that are considered negative, positive, and neutral.
Sure. And typically the notes are a lot longer, but we've grabbed snippets for the purpose of illustrating what we're doing here.
Sure.
And so we're going to take a look at some data-driven stories in artificial intelligence and natural language processing for individuals that self-direct. So some of the notes like you just saw, only for a given person. And so here we have Sharon. Sharon is not her real name. So you don't need to be a data scientist to know that something happened on this chart in October, November, December of 2021, right? And this is sort of the composite score of natural language processing when you have the machine read every one of those service notes day after day, week after week, month after month, year after year. The key is to try to identify periods of time where we're sliding more negative and try to provide some tools to the individual, to the staff, as appropriate to help provide interventions to prevent some of those negative outcomes. And so as we go through a couple of these stories, we'll start to explain how this all comes together. So this is Sharon. Sharon's mother passed away, and you can see in her service notes that it's really upsetting. They were very close. Every year on her mother's birthday, there's a dip contributing to grief and depression. We saw that for years. In 2020, around October, November, she is hospitalized for a pressure ulcer. She also finds it difficult to maintain proper hygiene after her hospitalization. You see a lot of depression and a lot of sort of lethargy to not necessarily want to get out of bed. And so she's also some of that proper hygiene. Staff are reminding, you should take a shower, come, let's shower. And she doesn't want to. And she gets into a situation where she's depressed, she's not getting out of bed, and she's frustrated. She's frustrated with the staff, she's frustrated with her living situation, she's frustrated with some mobility issues that come out of that. And she actually injures her foot, and she really has some mobility issues after the foot is compromised. And this is sort of, as you can see, this is getting in the way. She's overall fairly positive, but she's not doing well. She's not Sharon during this period of time. And you can see it in the notes day after day after day that this is someone that is struggling a little bit with lived situations like everyone does, except she is also ending up with UTIs and other items from not having the proper hygiene, and the foot, the injured foot is not contributing very well. And you start to see that, especially as we get into after the summer, the notes, one note after the next is just talking about how she's depressed and how, she's not herself. Finally, what you start to see in the notes is that after months of issues, she fires her staff, as the expression goes. If you can't change the staff, and she did. And right after that, she hires new staff, and she starts to see some immediate improvement. So there are probably many other factors to this, but this was pretty clear to us that Sharon and her staff were incompatible. And having identified that, I'm sure Sharon knew this earlier, but having identified that a little bit earlier probably could have saved some time if possible and had a better outcome where Sharon could have been on the upswing and could have been a lot happier and probably more independent if she had some different staff that was a little bit more compatible with her. And so it's helpful to see that. We mentioned in the beginning of this is not intended for any sort of HR purposes, but here's an example of a time where here's an individual, and probably the only people that knew that were Sharon and her staff, And the data was actually telling that story, and may have been able to share with Sharon, maybe even her staff earlier, that there was an opportunity to do something better. The National Council on Disability recognizes that risk management, remember, she did have the issue with her foot that came up, and that is based on a true story, but that happened. Um, it's right in the notes. Recognize that risk management is a critical ingredient in striking a balance between individual safety and personal choice and control, and recommending strategies for establishing and maintaining risk management systems. Many of the issues that Sharon had with her employees surrounded risk to her health and safety. Remember, she had many of those issues with hygiene. And of course, ultimately injuring her foot. This could have been addressed earlier to prevent many months of distress, both for the individual and probably the DSP as well. Here's another story that we have, and you start to notice these graphs. And by the way, for many people, when you run their graphs through natural language processing, they're fairly stable, straight lines. But for a good number of people, they're not straight lines. You see something like this. And so, okay, well, something happened here in April 2022, we can tell. But it looks like there's been some ups and downs all up and down until then. And so we have the opportunity to take this and actually look at some of those life events, look at some of those service notes. The machine read the service notes, but when we had humans read the service notes, we identified some of the reasons behind this. And while you're not going to have humans read every single service note ever, uh, many should be, you are going to be able to find some of these fits and starts and peaks and troughs here, and perhaps be able to make a difference in a person's life before they end up where they are over there in 2022, with this sort of spike down at the bottom over here. So let's take a look at the story. So this is Shawn. His name's not actually Shawn, but it is for today. And Shawn is an individual, seems a seemingly extremely happy and positive individual. Staff love him, and he loves life, and he loves his family. And you can see that in his daily activity. He's an important part of his community. He feels valued. He says it all the time, so that's how you know. And so he does have some issues with obesity and mobility. He describes what is vascular necrosis in his legs. And this gives him some challenge, especially with his obesity diagnosis. And over the course of time, you see that for Shawn. Um, every single day in every single service note, they are trying to remind Shawn that he should be on a low salt diet. Every single day and every single service note, you see that he knows he's reminded and prompted that he should be doing an exercise routine. And he has some fits and starts, but by and large, the strategy of just telling him every day isn't working. And one of the days, he ends up is making fried food for himself. He burns himself and he ends up in the hospital. And he's been in the hospital several times. He has some health issues. While he's in the hospital this time, um, he knows he has diabetes, right? And that's probably contributing to the vascular necrosis. But he's also on anxiety medication. So this is also probably some of the medications that he's on are probably not helping what he's doing. Also, what happens in 2020 around here? COVID-19, everything sort of shuts down, and a lot of his services and staff move to telehealth. He starts talking to them on FaceTime. And so that also, contributes a little bit to the situation. But like many, as 2020 rolls into 2021, he's feeling better, but he is having some health issues. Ultimately, he's hospitalized several times. One of these hospitalizations that causes to this sort of dip over here. Unfortunately, his diabetes has gotten very much out of control. His mobility is very low, and he needs an amputation below the knee for his vascular necrosis. And so this is Shawn. This is his situation where he is by 2022. We've been watching him since 2018, well, retroactively. However, like I said, he's a really positive guy. He gets back, he makes a recovery, he gets a scooter, and he's talking about how excited he is to be able to run errands for his mom. And the purpose of life is a life of purpose. He's back out there, shaking hands with members of his community, and living his life again. Now, he probably could have ended up in a situation that was a lot less painful and a lot better for his health, with some other different kinds of interventions. You keep doing the same thing over and over again, you don't get a different result. They probably could have ended up in a better spot that would have been a lot better for his health. And probably, he didn't want to go to the hospital. He didn't want any of these things. You can see it in his service notes. But here's a chance to see what the service notes tell us when we run them through machine learning. And it's really, when you look at outcomes in hindsight, balancing autonomy with protecting from harm. Right? Achieving that appropriate balance between personal autonomy and protection from harm is especially complex. The dignity of risk is the idea that taking reasonable risks is essential to supporting, it's essential to living, right? Balancing the need for autonomy while keeping a person's health and welfare in mind. So his recurring medical issues were clear for years. Perhaps some different oral education about a low-salt diet. Right? Well, it happened daily. Well, you got oral education every day. It really didn't have an effect. It shows that talking and executing on outcomes are two very different things. Shawn's the boss in his life. He's the decision maker of his own life. However, there may have been opportunities for Shawn to receive some educated options to better manage his diabetes to prevent the amputation, to maintain personal autonomy by maybe being shown different options, referred to a nutritionist, a trainer, potential complications of untreated diabetes. We didn't really see where that was happening. And Shawn self-directs. It's his life, it's his choice, but there's an opportunity to make some suggestions, and the artificial intelligence can pop those up. They could have made a big difference. So that is Shawn.
All right, and now I'm going to talk to you about Matilda's story. So Matilda's chart, as you can see, is fairly neutral to begin with, and then we hit a dip, and then we see a very extreme, climb. So what is the story behind Matilda? So she starts out fairly neutral, and then we learn through the notes that she has a cat, and the cat is hospitalized and given, unfortunately, a fatal diagnosis. However, the cat does recover for a point in time. And this is where we see a lot about that like trauma-informed care that we talked about earlier. Her staff and her circle of support were able to, work with Matilda to help her understand what was going on with the cat, help her care for the cat, and make sure that its last couple of months are really good, and that she has that support and understanding of what she's going through, because it's very upsetting, obviously, to have a sick pet. So unfortunately, we see in August that the cat passes away. But we don't, we see that there's a dip, but, she was fairly prepared and she understood what was going to happen. And then we see this huge spike, right? So then what happens to cause this huge spike in her positive sentiment analysis? Well, Matilda adopted a new cat from the local animal shelter. She still has continued purpose, right, to care for her cat. She's super excited to have a new cat in her life. And we see this, dip. And then it goes back down to more of like a neutral, her more normal levels. So what we kind of learned from this story is that obviously having pets, um, you know, is really important for people's mental health, right? And especially for people with disabilities, there's many benefits for pets. They help you relax. You can, learn from them and you learn better. You can prevent injuries and help to become more independent with that pet. But what this AI story really illustrates is someone's emotional state, and again, how your staff can help you overcome some of those hard times you might be going through. And so we really enjoyed this story. I thought it was, one of the, I guess, on the scale a little bit of a different story, because we hear a lot about other things and we don't hear so much about pets. But they are important to acknowledge as a part of having that whole person care.
It's just
What do you
another
talk about?
tool out there to help express for a person how they're doing, and where a person can express their needs perfectly well, but it also helps to be able to back it up with some significant data where the person may not know what's bugging them, but they know that something is, and the notes will tell you. And that's really helpful to be able to best support a person, is to just be aware and alerted when there's times and opportunities to probe a little bit further, to understand better what's going on, and how can we help, and what help do you want. And so now
So
we have the
what?
chance to bring it together, yeah, with some of the lessons learned and what's next.
So looking to the future, artificial intelligence and self-direction, right? So to recap, everyone has a right to make meaningful decisions about their life, and there are opportunities for equity improvement and service delivery with a focus on increased independence, flexibility, empowerment, and quality of life that we mentioned earlier in this presentation. Having this access to data through the artificial intelligence and review of notes can help identify issues earlier, which can support interventions earlier and sooner, and just make everything overall easier to identify to help live that whole person centered life. So as we shared with our data stories earlier today, we saw people making meaningful decisions about their lives, including health decisions, safety, companionship, and independence. So looking to the future, machine learning and human services, what do we think are the kind of next frontiers? So for today's presentation, we focused on machine learning with sentiment analysis. And we're really excited to look to the future to mine service data know in other ways. So we have a list here that's, not limited to, but just some of the things that we would love to look at next, using sentiment analysis and natural language processing. So we have, health diagnosis and events, detecting abuse and neglect, identifying any unmet needs, transportation, feedback on your staff and programming, employment opportunities, community integration and relationship highlights, and housing and food security needs.
Alyssa. And with that, we love talking about all things self-direction. We love talking about all things home and community-based services. And we love talking about artificial intelligence. And this is our little robot. I'm Doug. This is Alyssa. Feel free to email us. If you use Metascale software, we are partnering with several clients to do some early adopter work. And if not, you just want to learn more, we love to talk. So thank you so much for coming today and getting a little bit of a glimpse of what 2029 looks like right here today. We're moving that date up for CMS and for everybody. And thank you for attending this. Thank you for attending this conference and for all that you do. Have a good day.
Thank you.